Hey, I'm Vic Senese, and this is UroNurse News. You know the drill. Today, an important cardiovascular update for men receiving androgen deprivation therapy for prostate cancer. New data published in JAMA Cardiology suggests that coronary artery plaque may progress faster in men treated with Leuprolide compared to Relugolix. Now let's break that down. The findings come from the Revolution trial, short for Relugolix versus Leuprolide cardiac trial, registered on clinicaltrials.gov. This was a randomized open-label study involving 65 men with non-metastatic prostate cancer. These were ADT naive patients, meaning they had not previously received hormone therapy. The men were treated at 4 centers in Atlanta, Georgia, and all received pelvic radiation therapy in addition to androgen deprivation therapy. Participants were randomly assigned to one of two groups: Leuprolide, given as 22.5 milligram injection every 3 months, or Relugolix, which taken orally at 120 milligrams daily after a 360 milligram loading dose. Treatments last 6 months or longer. The average age of the participants were 68 and a half years. Now, here's what's important. At the start of the trial, 56% of the men were already taking statins. The average cholesterol was 176 milligrams per deciliter. 1/3 had intermediate cardiovascular risk. 1/4 were considered high risk. So this was not a low-risk population. The endpoint of the study: change in total coronary artery plaque volume, measured by coronary CT angiography at 12 months after starting ADT. So here's what they found. From baseline to 12 months, median total plaque volume increased by 56 cubic milliliters in the Leuprolide group, while in the Relugolix group, the increase was 25 cubic millimeters. After statistical adjustment, the Leuprolide group had an estimated mean 68.9 cubic millimeter greater plaque increase compared to Relugolix. That difference was statistically significant with a p-value of 0.2. But here's the key detail. The increase was driven primarily by non-calcified plaque. Non-calcified plaque is considered less stable and more prone to rupture, and plaque rupture is what can lead to heart attacks. In fact, non-calcified plaque volume increased by a mean of 64.3 cubic millimeters more in the Leuprolide group over 12 months. Now that's clinically meaningful. Now here's another critical point. Testosterone suppression was similar in both groups. So this was not a case of one drug suppressing testosterone more than another. The cardiovascular difference appears to be drug pathway specific. Investigators led by Dr. Sagar Patel of Emory University concluded that the cardiovascular effect of ADT is detectable in near term and at least partly mediated by coronary plaque progression, independent of testosterone suppression. Independent of testosterone suppression. Got that? These findings also support prior cardiovascular safety observations seen in the HERO trial, which previously suggested fewer major adverse cardiovascular events with Relugolix compared to Leuprolide. So now that we have imaging evidence, not just clinical evident data, showing differences in coronary plaque progression, what does this mean for patients? If you're a man with prostate cancer, especially if you have existing cardiovascular disease or significant risk factors, this data may influence the choice of ADT agent. It reinforces the importance of collaboration between urology, oncology, cardiology, and primary care, because cardiovascular risk assessment before initiating ADT is essential, and ongoing monitoring matters. Quick note of disclosure, this research was partly supported by Pfizer and Sumitomo Pharma, Switzerland. It's always, as always, review full disclosures and understand funding sources is a part of responsible interpretation. So, what's the bottom line here? Both Leuprolide and Relugolix effectively suppress testosterone, but in this randomized trial, coronary plaque progressed significantly more with Leuprolide. particularly unstable non-calcified plaque. For men with prostate cancer and cardiovascular risk, that difference might be meaningful. This is UroNurse News, bringing you the data that matters in urologic and men's health. Tomorrow on UroNurse News, what if I told you that some snakes don't have the so-called hunger hormone? Do you care about a hungry snake? That's right. A new scientific discovery suggests certain snake species may lack GnRH, the hormone that tells us when it's time to eat. So how do they regulate appetite? How can they fast for weeks or even months? And what could this mean for metabolism research, obesity science, and our understanding of human hormones? On tomorrow's UroNurse News, I break it all down, the biology, the evolutionary mystery, and why researchers are so fascinated by this finding. If you love cutting-edge science explained in a clear, clinical, no-hype format, you don't want to miss this one, folks.
Breaking news, clinical guidelines, and research insights, delivered weekdays at night, designed specifically for busy urology professionals. UroNurse News, your daily update.